Next section, uses of clinical sociology in crisis intervention. Overview. A person with a severe crisis can undergo a significant amount of psychological stresses, which carries links to major depressive disorder and other mental health conditions. Clinical sociology in crisis intervention is effective in preventing the development of mental illness, but it can also be used in a clinical setting to treat patients currently suffering from diseases. Emergency departments with crisis intervention teams for adult and pediatric patients, reasonable reductions in return visits and duration of stay. Clinical sociological crisis care reduced the number of repeat admissions to the hospital and is more effective than standard care at improving the mental state of patients. Meaning of crisis. A time of intense difficulty or danger. Example, the current economic crisis. A crisis of meaning is often caused by critical life events. Example, failure, illness, death, divorce, or job loss. Natural and man-made disasters linked with a loss of one's sense of coherence in life and results in questioning life's purpose. Define crisis intervention. Crisis intervention is a short-term management technique designed to reduce potential permanent damage to an individual affected by a crisis. A crisis intervention is defined as an overwhelming event which can include divorce, violence, the passing of loved one, or the discovery of a serious illness. A successful intervention involves obtaining background sociological information on the patient, establishing a positive relationship, discussing the events, and providing emotional support. Uses of Clinical sociology in crisis intervention. 1. Crisis intervention is a practice-oriented set of procedures designed to offer someone experiencing incapacitating stress emotional first aid. Second, concepts and ideas found in the sociological tradition are quite applicable to crisis intervention practice. Three, what has been offered are alternatives to the traditional psychological and psychiatric positions. 4. There are similar characteristics between crisis intervention and clinical sociology as change strategies. 5. Particularly the ideas found under the social psychological preview serve well when practicing crisis intervention. 6. The interpretation of crisis events is a social act in that the individual experiencing the crisis is influenced through social circumstances. 7. Social circumstances play a vital role in crisis formation and intervention. 8 intervention strategies are offered which integrate aspects of clinical sociology while using a case study for application. The crisis intervention steps include crisis assessment, information gathering, control, direction, progress assessment, and referral. 10. Through these procedures, the interventor may work with the client towards the goal of socio-emotional stability. Thank you. Have a nice day.